Good evening, all, and welcome. My name is Dr. Heather Finletter-Hines, certified nurse midwife, and I am the in-house midwife for the nesting place located in Yaphank. Thank you all for joining us tonight. And as you learn more about the wonderful midwives that serve birthing and reproductive people here on Long Island, the team at the nesting place is passionate about holistic health and helping connect folks with patient-centered care like the care midwives deliver. So let me start off with myself. I am the midwife of One Love Midwifery. Yes, if someone just said like Bob Marley, yep, his birthday was this week. As a midwife of 22 years, I've had the privilege of supporting patients through the life cycle from puberty to menopause and providing evidence-based care with an emphasis on individualizing each person's experience. I'm proud to say I am a community midwife, offering both home and hospital birth. And enough said, I'm going to turn it over to the president of the Long Island Midwives, Amanda Cini. Take it away.
Hi, everyone. Thanks so much for spending your evening with us. I know this is, it's a convenient time for most of us, but it's also tough because it's bedtime for all of our little ones. So just like you, I may have a little one joining me right here on my bed later who needs to lay down and go to bed. But I'm going to start off with just introducing midwifery care to y'all and sharing some slides with you. And then we're going to open it up for some chit chat from a patient who's experienced midwifery care, all the practices from Long Island, and one of our doulas who works with the midwives of Long Island, and then questions. So if you have questions that come up and you're afraid you're going to forget them, put them in the chat right now. We'll make sure to hit all the questions at the end, if that's okay. Laura, are the slides up? Yes.
Do you not see them?
I don't. I see.
They're up.
I don't know. I saw them before, but I don't see them now. Hang on. Let me see if I can find them.
What's up is what do midwives do?
I got it. Thank you. I'm not so tech savvy like Heather. All right. So for many of you, this may be preaching to the choir, but we really want to reach the masses because we really believe in what we do and we want to share what we do with women. So hopefully you'll learn something tonight. And if not, hopefully you'll be able to pass this on to people who, could use this information. We just really want to get the good word out there because there's so much great things that midwives do, and we can really serve the women of Long Island. So midwives in New York are licensed independent providers, which means we can independently take care of our patients. We see women from pre-adolescence through post-menopause. So basically, aside from pediatrics, we're really seeing the full gamut of a woman through her life cycle. We provide primary well-woman care, including gynecological care, care during pregnancy, birth, postpartum, and immediate care of the newborn following birth. Some of the things that we do as midwives, we provide annual GYN visits, we treat and diagnose common GYN problems, we provide contraception counseling, initiation and surveillance, we provide prenatal care, childbirth care, postpartum and newborn care, perimenopausal and menopausal care, primary and preventive care for women, and a lot of us also do a lot of counseling and education in our care. So whatever you're coming to us for, aside from just your basic physical and your blood work and the physical care we're giving, there's so much education that goes into how we aid a woman in her transitions through her life cycle. A lot of people come to us with the question, are there different types of midwives? In the United States, there are basically 3 types of midwives. There's certified nurse midwives, certified midwives, and the certified professional midwife. In New York, certified nurse midwives and certified midwives are considered licensed midwives, and all of us are one or the other. Certified professional midwives practice in other parts of the country, but it's not practiced in New York. For a complete description of the differences, you can see the link below. And as I already touched on, we are, as midwives, we're independent providers, so we do not need to work under MD supervision. But with that said, we all have many collaborative relationships with doctors all over Long Island who help us, if we have to consult with them or we need to transfer a patient to them, we just need to talk about a patient. We all work very collaboratively. We're lucky to live in a place where midwifery is so accepted. It's not like that everywhere. And I think that's in large part due to someone I hold in such high esteem, Chris Kosis. I don't know if you're here with us tonight, but Chris with the Stony Brook Midwives has just really paved the way for midwives to be so kind of ingrained in the OB care there. And a lot of other hospital systems have done the same. So we're really so lucky that it's something that's widely available here on Long Island. I think that's it with that slide. And so where do we work? We work in hospitals, we work in birth centers, we work in offices throughout Long Island that are either affiliated with hospitals or independent offices of midwives who have their own private practices. And we also do home births. So we're in the homes of many Long Islanders, serving them right, on their own turf. So I'm going to turn it over to Jamie Carroll, who's going to talk about midwives in the hospital setting. Jamie, whenever you're ready.
Sure. Hi, everyone. My name is Jamie. I am a midwife practicing at North Shore University Hospital. So as Amanda mentioned, midwives attend births in the home setting, in birth centers, and the majority of midwives in this country actually attend births in hospitals. Inside the hospitals, we're still able to provide low intervention care for clients who desire that. We're also able to provide, higher levels of care. So clients to opt to have epidural anesthesia, clients who may need to be transferred to physician care for a higher level of care, or even clients who may need a cesarean birth, whether that's unplanned or planned. There are midwives in most of the hospitals on Long Island right now, which is something we're really proud to say.
Thanks, Jamie. All right, Michelle's gonna give us a little talk about home birth on Long Island.
Hi, everybody. My name's Michelle Leo, and I am a community midwife, and I'm going to give you a quick little blurb on home birth and some of the commonly asked questions. I did notice it came up in the chat about insurance coverage, and here's a little blurb with regards to home birth. So again, just like all the midwives before me have said, we provide low risk care to the low risk person, individual, and optimize support of the physiologic process of birth. So home birth, because we're in the out of hospital setting and therefore a lower resource setting, we definitely really have to ensure that the low risk profile is maintained. But fun fact, the CDC reports that 85% of women are considered low risk. So a comprehensive health history, medical history, obstetrical history, social history, et cetera, can help us with shared decision-making to determine if a birthing client is a good candidate for the out-of-hospital setting. And then we maintain the same schedule of care that any provider does by ACOG standards, the American College of Obstetrics and Gynecology. As Amanda mentioned previously, and Jamie reiterated, we are not required by law in New York State to have a collaborative agreement with any physician. So we are autonomous practitioners, the certified nurse midwife and the certified midwife, who is licensed in the state of New York. There are many of us across Long Island, and we're all going to be introducing our practices throughout the evening. Equipment, we bring lots of it. Please feel free to ask your potential home birth midwife with regards to what they bring, but all of us baseline are bringing what you see listed here. Transfer rates. Oh goodness, sensitive subject in this moment. Typically it's a first time birthing individuals seeking transfer for pain management is the most common reason for transfer in the home setting, but there are other reasons too, and they're often, as said in this slide, unique to the labor trajectory. Definitely things to discuss in a meet and greet with your potential practitioner. And finally, insurance coverage is a good one to talk about. the majority of us are out-of-network providers, and but work diligently with a billing practice to help try and obtain some in for out-of-network coverage or gap exceptions. And there's a lot of lingo with regards to that, but we do work to attempt to obtain some reimbursement to help assist in the coverage of your out-of-hospital birth. I think that for now covers the short and sweet on home birth.
Thanks, Michelle. All right, so one of my friends and Tanya's gonna be talking tonight. Tanya has, well, I'll let her tell her story. Tanya, are you there?
I am. I'm just trying to figure out how to use technology because I don't know how to unlock my screen. I think I got it. Hold on.
We can hear you.
Okay, perfect.
Hi.
There we go.
So much for
Hi.
being here.
My name's Tanya. I am a mom of 4. 3 of my children were hospital traditional OB care births. My 4th, which was my surprise baby, was my only midwifery care home birth. And if I could do it all over again, I would absolutely choose the home birth midwifery care 100% every time. So I have my oldest is 11. Prior to having her, my husband and I experienced quite a few miscarriages and infertility. So a lot of our OB care started, not such a great experience. And it kind of trickled from there. My twins, although I knew more at the time, I didn't have a great experience with our OB at the time. I went in with a lot more knowledge and fought for what I wanted, but it was still a big fight. So when we had our 4th, we knew we really wanted a totally different scale of care. So we went with Gaia. Amanda was actually our delivering midwife, and Michelle was on call. I know I talked to her about 100 times in like an hour. Hi, Michelle. And just from the start, it was such a different experience. From the time I called just to make the appointment and I talked to Colleen, you could just tell that they really truly wanted you to have the birth that you wanted, and that you weren't a chart, you weren't a number, you weren't just somebody going to have a birth that, you don't know who's going to show up to your hospital bed at that point. It was nice to rotate through all the providers in their office. You get a chance to know them, you meet their personalities, so you know who you're potentially going to see. You don't get to know somebody and then they just don't show up. You know that they're there for you through the whole process, even if it's just a phone call. So it was nice. Even going into the office, I was always given choices, lots of information to make choices that I wanted for myself and my birth, and my body and my baby, and not just, okay, so here's what we're going to do. Here's the information, but you have the information, but I'm making the choice for you, which never sat well with myself. But I didn't know any better at the time because I didn't feel like I had a lot of the support that I needed from my other kids. So it was such a great experience just to have more options. I got to pick and choose what care I wanted in terms of testing, and if I wanted to have an ultrasound, I could. If not, totally fine. But it was really left to me to kind of experience birth and my care in a way that felt good. And the choices were just amazing. So we had a great experience with Gaia, with midwife. And again, if we ever had more kids, which is not happening, but if we were, I would 100% choose this route again. It just was such a great experience.
Great.
I don't
Thank
think
you
you have
so
any
much,
specific
Tanya.
questions, but
if anybody has any questions for Tanya and wants to throw them in the chat now, we can address that, or we can address it later. I know Tanya is going to have to go put the baby to bed soon. So if you have
she's already crying, but I can keep this up for chat. So
all right, if you want to message Tanya about anything, feel free to, and we can kind of facilitate that. But thank you so much. We really
of course,
appreciate
thank you for having me.
taking the time to be here.
Of course.
All right, so if we don't have any questions, I think we're going to move ahead and start with the midwives from each individual practice, and we're going in alphabetical order. So Michelle, you're up.
Great. All right. So I'm Michelle Leo of East End Midwifery Services. It's my new practice, except I'm now 1 year old. Yay! Caught a bunch of babies, really feeling thrilled and joyful. I have an office in Southampton, and I see clients there on Wednesdays and Thursdays. And then obviously I see clients in their homes as well, based upon, scheduling, etc. My MO, I provide individualized, inclusive, professional midwifery healthcare to my East End community. I really want to be, it's been a dream of mine since I was a very young child, and my mother was a childbirth educator, and I used to help put the pillows out before childbirth ed class when I was about 9 years old. And then I was in attendance for the birth of my mother's H-back, and got to cut the umbilical cord of my 13-year-old. At the time I was 13, my brother, who's now 28. So a long held dream of mine to be a community midwife serving my specific community. And I feel really blessed to have been able to achieve that dream. So here I am. Like I said, I provide gynecological services as well as prenatal birthing services and postpartum care. I love everything that I do. I work with a phenomenal birth assistant, Noelle Butler, and then I have some other, as Heather refers to them, backup dancers who also support me in the event that Noelle may not be available, because she wears a few hats like myself. And I think that's kind of it. My background is I've been a certified nurse midwife. I'm in my 3rd year of that. I graduated from Stony Brook. I've been a nurse for 15 years. A lot of that time was spent in labor and delivery at Stony Brook University in the high risk setting. So I have a broad exposure to acuity levels. I had both of my children in my home, and I was also born at home back in 1981. So long history of home birth. And we'll see what my children choose into, right? And see if it becomes a generational stuff. So that's my story. Feel free to reach out. I have a website. It's called East End Midwifery. I have a phone number. It's all on there. Feel free to reach out, shoot me a text, anything. That's it. I love what I do. Yes, to the nesting place. I do GYN also. I love gynecological care. I think it's a beautiful practice, and I really embrace that. So yes, thanks everybody.
Thanks, Michelle. All right, Jamie, you're up.
Hi, everyone. My name is Jamie. Michelle, nice to see you. Michelle was at both of my births, so we're all friends on here. I practice at Great Neck OBGYN in Great Neck. It is a private practice. It's myself. I'm a midwife, and I work with 3 awesome physicians. I provide full spectrum care. So I do GYN preconception, contraception, GYN problems, and then mostly prenatal care. And then I get to catch babies at North Shore University Hospital. It's a little confusing because there's both North Shore and LIJ, and they both have Katz Women's Hospitals. So I'm at the one in Manhasset. Because I work with physicians, I'm able to see and care for higher risk clients. So including clients who have a history of high blood pressure, twins, patients desiring a vaginal birth after a cesarean section. Just some examples, there's plenty more, gestational diabetes, etc. I love what I do. Also, similar to Michelle, lifelong dream to become a midwife, and love serving the families of Long Island. You can catch me on my website, as well as my office numbers there as well. Thank you.
There are no phone numbers on these.
I'm happy to put it in the chat.
Thank you.
Maybe we should all do that at some point. Just put your name, your practice, and your phone number. Okay. And someone just asked if we could make a list. We can definitely make a list and send it out to the email. Everyone who is in attendance. So if you want to pop your stuff in there now, that's fine. And we'll definitely send a list. Okay. Thanks for the suggestion. All right, Gaia, you're up.
Hi, my name is Colleen, and I am one of the co-owners of Gaia Midwives, which is now in its 6th year of practice or of existence as its current iteration. We are blessed to have been able to take over the spot that Dale Cook held for so long on Long Island, and she was just one of the great pioneers of community birth here on the island, and it was an honor to learn at her feet and to just participate in just educational process with her. She was just amazing. So at Gaia, there are 4 midwives. We provide full scope care, from teens through menopause. We do home birth, hospital birth, and depending on construction and New York State getting their act together, we will also very soon hopefully have birth center birth located in Smithtown. The construction is happening on that, and there will also be a wellness kind of center component to that as well. So we're really excited. There's a lot of big changes, a lot of big things going on. I would just reflecting back on why Gaia exists, why I'm a part of this. When we sat together, actually Ashley and Amanda and I at Ashley's dining room table, the goal was to provide a location and a practice where people could have, as Tanya stated, like truly autonomous care. The way I like to describe it is we feel like, you're the driver of your own vehicle, and we are just there to help you read the roadmap and to maybe warn you of speed bumps ahead, but that you get to make all the decisions and you get to direct the vehicle where it goes. So we're just there to provide gentle encouragement, to provide education, and most importantly, just acceptance, love, and support as you journey through what is one of the biggest times of your life. And that includes even through GYN care. GYN care shouldn't be the worst day of your entire year. We believe that it should be gentle, and it should be surrounded by love and care. And that it's not just taking your physical health into mind, but also your spiritual and your emotional health as well. So that's who we are at Gaia. Again, we're a home hospital. We have 3 offices, one in Riverhead, one in Smithtown, and one out in Greenville. So we kind of spread across the island, and we attend births at in Nassau and Suffolk counties, and at South Nassau University Medical Center, and also, or South Nassau Hospital, sorry, and at Stony Brook University Medical Center.
Thanks, Colleen. All right, Laura, you're up.
Hi, everybody. My name is Laura Jabor. I am here representing my practice. We are Huntington Midwifery, or Northwell Midwifery at Huntington Hospital. We are a group of 5, soon to be 6 midwives, and we do all our births at Huntington Hospital. We have offices in both Huntington and Comac. We're going to be adding back Smithtown soon, and we will eventually be adding Bethpage as well. So we're growing definitely by leaps and bounds. We, like I said, are a hospital-based practice. We fall under the umbrella of Northwell OBGYN, but we are able to maintain a completely private midwifery practice within the Northwell OBGYN practice, which is great because we have a lot of referrals and we have a lot of resources available to us working in such a big system. So yeah, we do comprehensive well woman, GYN, prenatal care. We have a lot of women looking to VBAC. What else can I say? It's really it. We're pretty run-of-the-mill, but comprehensive midwifery practice.
Great. Thank you so much, Laura. All right, Michelle, you're up.
Me, Michelle?
Michelle Sauls.
Okay. Every time you said Michelle earlier, I was like, was that me? Was that me?
Sorry.
No, that's okay. So hi, everybody. I'm Michelle Sauls. I'm also a midwife. I'm here to talk about Stony Brook midwifery practice, as well as my own practice of perinatal psychiatric mental health. So
talk about your practice first, and then when we get to Stony Brook, you and Rakaya can.
that sounds good. Okay, so let me backtrack. I'm here to talk about my psychiatric practice.
Thanks.
So I am board certified in both midwifery and I'm a nurse practitioner in psychiatry with specialization in perinatal mental health or reproductive psychiatry. And I became interested and passionate about this field working at Stony Brook as a midwife and encountering so many women that were on psychiatric medications and were told to just stop them or switch to something else or lower their dose or do things that didn't make sense, and ended up just becoming very depressed or anxious and having to pick up the pieces and not having anywhere to send people because people are kind of reluctant to take care of pregnant women sometimes for fear of hurting the fetus. So I decided to go back to school and become a psychiatric nurse practitioner and started working with these women. And it's just a wonderful thing to do. And I have recently opened my own practice, seeing patients privately. And I also work part-time at Stony Brook, and I've helped develop a perinatal, an OB perinatal psychiatric program, an integrated program in the ambulatory clinic at Stony Brook as well. So that's me. I'll put my practice is Michelle Sauls, psychiatric nurse practitioner, but I'll put my contact email and my phone number in the chat. If anybody has any questions or just wants to talk for 15 minutes, feel free to give me a call.
It's so good to have you in the in this area, Michelle, because as you know, I've called Michelle many times, and it's just to have a midwife as a psych provider. It just, as midwives, we're trained to see the whole woman, including her family and every aspect of her health. And now to have someone who embodies that, who can also really deeply address psychiatric needs, it's a game changer. So thank you.
Thank you. I feel like it brings a lot to women to have
really
somebody
does.
that's from that perspective. Thank you.
Of course. All right, Heather.
Well, I talked earlier, but I guess I should give a little background. So as you guys know, I'm Heather. I am a midwife that opened a practice in September after being a Stony Brook midwife for almost 19 and a half years. I am the midwifery program director, the educational program director at SUNY Stony Brook. That means I teach RNs, nurses, how to become a midwife. And it's been really nice to have touched so many young midwives and new midwives and seasoned midwives here on Long Island, because in my 22 years, I've either precepted or done something with them. So being evidence-based and being current and educating really helps to tie together my practice, right? Because love ties us all together. So one love, that's how that started. The thing about my practice that I'm really proud about is that it's building community, one birth, one visit at a time. It's evidence-based. It's no trauma. Too much trauma happens in healthcare today. And that starts from people not knowing their providers. And when I wanted to craft a practice, I really wanted to know the people that I was taking care of. Those people, I want to make them feel empowered. And you can only do that by getting to know them. That's the way to mitigate risk, by knowing the clients. So I'm grateful for the ability to be here on Long Island, serving my community as a midwife and educator, a chair of a legislative task force. We have to improve outcomes for birthing individuals here in Suffolk County. Brown and Black women are dying, and the only way they can do that is have providers that provide care. And you know what? Midwifery is equitable care. It provides care across the spectrum, and it does not look at race. And that's really awesome. I believe every individual who's having a baby needs a doula. It's a part of the team. And I think by having midwives, having doulas, having education, you can have the birth that you desire. And I think that's awesome. So that's me.
Thanks, Heather. That's awesome. All right. Elizabeth, are you on?
Hi.
Hi.
So good to see everyone. I'm Liz Morrison, certified midwife at Peconic Bay Medical Center in Riverhead. There 3 midwives were in the mix with the physicians, 5 physicians, but myself and one other midwife, Andy Ferrer, we share being on call for women who want, to know who will be with them and who want a midwife specifically. And we only deliver at the hospital at Peconic Bay Medical Center in Riverhead. And I'm also working on my IBCLC. And we're blessed that we were, invited to work at Peconic Bay. They had never had midwives before. So it's really, good to be working there. And good to see everyone. I graduated from downstate 5 years ago. Prior to that, I worked, with Dale Cook, with Gaia as her midwife assistant as I was working through my journey to midwifery. And then before that, I was a doula. So very embedded in this birth stuff, and I'm grateful that you guys are all doing this, and grateful to, be a part of sharing this collective wisdom. Thank you.
Thanks, Liz. All right, Rachel, it's your turn. Maybe she's at a birth. Rachel, you here? All right, let's go ahead, and if she comes back, we'll come back for her. Sam, are you here?
I am here.
Right.
Hey.
Oh, we got you a few minutes ahead of time. Is that okay?
Yes, that's okay. I believe Janelle is also on. So I am Sammy Sternbach, and my partner Janelle and I work at Stony Brook Gynecology and Obstetrics, which is different than the Stony Brook Midwives. We are part of a private practice along with 5 physicians, and we deliver babies, or we attend births rather, at Stony Brook Hospital. We also provide gynecologic care along with obstetric care. And I actually, as Michelle was mentioning, that it's her practice's birthday, I just realized that February 7th was my first day at Stony Brook Gynecology and Obstetrics, and I was their first midwife. So this is, so February is the birth month of the midwifery arm of Stony Brook GYN and OB. As it is still new, we are finding our footing with our physicians, and how that midwifery arm plays a role in caring for women. Right now, when women are birthing in the hospital, they may get a midwife. They may also get one of our physician colleagues. And we are working towards the possibility of 24/7 midwifery coverage, but we are not there yet. And Janelle, are you on? Would you like to add anything?
I'm here. No, I think he said everything.
All right.
But I'm Janelle, the second midwife that works in the practice.
Hi, Janelle. Thanks for coming.
Oh, sorry. I just remembered one thing. Sorry. We have 3 offices. We have an office in Bohemia on Sycamore Avenue. We have an office in Rocky Point. And then we also have an office in Setauket on Main Street. And something that's very unique about our office in Setauket on Main Street is that we have a gynecologic urgent care. And we are available for same-day appointments and walk-in appointments as well. That's with the midwives and the physicians. But I'm very happy that we can get women and people in to be seen if they have a gynecologic issue same day. So that's one more thing. Thank you.
Great. Thank you, Sammy. All right. Now we have Stony Brook Midwifery. So we have Rakaya and Michelle Sauls.
Who wants to go first?
You go first. I just spoke.
Hello, everyone. My name is Rakaya Watts. I am one of the midwives with the Stony Brook Midwifery practice. I have been with the practice for a little bit over 5 years, but the practice has been here for over 25 years. We serve the families of Long Island, and we have offices on the North Shore of the island in Comac and Setauket, and also the South Shore in Bohemia and Hampton Bays. We provide full scope midwifery care, so all the way adolescence through menopause. In terms of our delivery care, we do that at Stony Brook Hospital. We also provide, in addition to traditional prenatal care, meaning patient and midwife, we do centering prenatal care, which is a model of care where you are grouped with other patients who have a similar due date or due month, and you go through the pregnancy together with the other birthing people, which is a pretty cool thing. We also have lactation services. So 3 of our midwives are also board certified IBCLCs or lactation consultants, and they do lactation hours in all of our offices. So that's another thing that we do. And we are happy to be here tonight to introduce you all to our practice.
Thanks, Rakaya. Michelle, do you want to add anything?
I just want to say that something that Heather spoke to about trying to make GYN care and OB care not traumatic. I think that that's so important. I think that's something that kind of binds all the midwives here together, is that it should be non-traumatic, and it ends up being so traumatic for so many people. And I think that that's the core of what we do as midwives. I know everybody I see and know here strive for that. And, you know, working at Stony Brook and experiencing that collective desire to give a person an empowered, beautiful memory, no matter how it ends up, C-section or vacuum or natural vaginal birth. I think that that's really what this is all about, what we do. That's all. And I love being a Stony Brook midwife, very proud of the work we do there.
Perfect. Thank you. So true. All right. And that brings us to me. So, hi, everybody. I'm sorry, my daughter's coming. Okay, that's fine. Not now. Okay. My name's Amanda Sini, and I am the owner and midwife at the Village Midwife here in Babylon. And my background is I was a former Stony Brook midwife for about 6 years. And then I was a founding member of Gaia Midwives. And about 1 year and 9 months ago, I started a private practice right here in Babylon, where my practice focuses solely on women's wellness and holistic gynecology. And I see patients Monday through Friday, and my patients range from pre-adolescent young women through post-menopause. I do annual exams, I do GYN problem visits, I do birth control counseling, initiation and surveillance. I do a lot of hormone balancing, a lot of perimenopause and menopausal management. And I also recently became certified as a health and wellness coach, because a lot of times my patients come to me like, oh my gosh, that was the best PAP of my life. And I got a therapy session, I got a nutrition session, and we did it all, and I'll see you next year. And I wanted to be able to offer that more regularly. So I do now see clients on a regular basis, so that I can help them with their lifestyle choices and all the things, I just mentioned, on a more regular basis, rather than seeing them one time a year. I'm a huge believer that food can be our medicine and our poison. So we really have to figure out like what works for our body. And so I do a lot of nutritional counseling, and that's something else I'm going to explore deeply educationally, because it's something I've educated myself on and I'm able to work with clients on, but it's something I want to take kind of to the next level. So that's my next area of education that I'm going to focus on. My days of full scope midwifery are over, but I'm so loving this new phase where I get to really work with women and have great follow-up and, help them not birth their babies anymore, but birth the best version of themselves. So thanks. Turn this off. All right,
And-
next up is Gianna. Gianna's a doula who's worked with a lot of us, and she also teaches yoga at the nesting place, and she's gonna kind of talk about midwifery from the standpoint of a doula. So welcome, Gianna.
Yes, hi everyone. Sorry. My name's Gianna. I'm a birth and postpartum doula on the island. I also teach yoga, as Amanda said. So I have sort of a different experience, I think, as well as a doula, because I've never had children myself. So a lot of people are like, how do you know about all this, right? So I just wanted to share a little bit how I even found midwifery. I think my background on birth that I'd heard growing up was always very negative. My mom had pretty traumatic births with both my sister and I. We were extremely premature, NICU. She was in the hospital for months before she had me, sort of thing, at Stony Brook, actually. So I, like I said, only ever heard negative experiences. And then I stumbled across a YouTube video about some woman talking about her birth story. And I was like, what the heck is a birth story? Like, I didn't understand why someone would be talking about that. And then she talks about having a midwife, and I was like, oh my gosh, this is so cool. So from there, I just became like obsessed with birth. And then I actually graduated from Stony Brook University with my degree in psychology, and the Stony Brook Midwives came into one of my classes. It's the sociology of human reproduction. If any of you midwives have been in that class, I was a student and I was like, oh my gosh, this is amazing. So that kind of encouraged me also to become a doula. And I've been lucky that I've actually worked primarily in the past a little over 2.5 years with midwives. So I've done a lot at Stony Brook. I've also had a couple of home births. So yeah, I just was amazed at seeing how they truly listen and really, like everyone's saying here, right? Like all the things, like they really practice what they preach. I didn't realize birth can be such a positive experience, and how they're telling you when they're doing something, okay, I'm touching your leg, and they're asking, can I check your cervix? So they really are trying to make this as least traumatic of an experience, which is just so encouraging for me to see as a doula. And eventually one day when I have children, I know I will definitely be using a midwife. And like I said, after only hearing really negative experiences, I think it's really refreshing to see just this community support from everyone. And I didn't, especially for home birth. I mean, it's amazing in the hospital as well. I'm not putting down hospital birth, but it's so like relaxed and just normal. Like I remember at my first home birth, I don't know if Michelle even knows that was my first home birth. It was actually my second only birth ever. And they're just walking around the neighborhood, and she's just sitting there relaxing, like, oh yeah, like you're doing great. And it was just so encouraging. So you definitely, I've seen some amazing OBs as well, just as a doula, but very different. They're just sort of in and out, and they don't take that real like interest in, kind of like Heather said, really getting to know who's giving birth. So that's really cool. And then really quickly, I wanted to talk about my personal experience as well with GYN care from midwives, because I had always seen an OB, and I've dealt with a number of, I don't know if you call them issues, but different hormonal imbalances and whatnot. Definitely PMDD, which is, what is it? I don't even know what it stands for. Depression related to your period. So I just did not have great experiences with OBs, who pretty much were just like, here's 2 solutions, birth control and an SSRI, which I've tried those routes, and I think that they are great options, but it just isn't what I wanted. So it was really nice to go see midwives who truly were like, what do you want? And we're going to find you a plan and a solution that's going to work for you. And it has been working. So that's really amazing. And yeah, thank you guys for listening and for having me.
Thanks, Gianna. We really appreciate it.
Thanks.
All right, so I think that's it for our presentation. So if anyone has any questions that they'd like to submit, please throw them right in the chat. We'll stay on until the questions are done. And if anyone has to jump off, feel free to. You know, the large majority of us can, or the we don't need the large majority to be here to answer the questions. We all can kind of cover for each other, right? So if you have kiddos to put to bed or work to get to or whatnot, we can stay on and answer any questions. If anyone else has anything that they want to say, or they want to raise their hand for like a live question outside the chat, I think that's fine too. Just let us know.
I just wanted to answer a question that I just got about doulas, if I can. So someone asked if doulas are usually out of network, pay out of pocket, or can they be covered by insurance? I know there's ways doulas can be covered by insurance, but I would say primarily on Long Island, most doulas do not take insurance. But there are a lot. I know I personally offer different payment plans. And then I think Caitlin's on here with Be Her Village, which is a gift registry that it's a cash gift registry that you can put your doula on there so you can get family and friends to give you the support you need instead of baby things that you often do not need. So yeah, just a little plug for Be Her Village, but I would definitely, okay, Laura's saying doulas can also give you a receipt to submit your insurance for reimbursement. Yeah, that I knew there was like some way you can try and get that covered. And as well, the Long Island Doula Association, LIDA has a community support fund, so you can apply to see if you can get coverage, like a free doula essentially. So yeah, there's a couple different ways. I would definitely look into them and not just rule out doulas because of the price.
Thanks, Gianna. There's also a question about coverage and paying for a home birth. Someone want to jump on and talk about that? Prices for a home birth and midwife.
Prices vary from practice to practice, and a lot of it depends on insurance as well. I think the best way to figure out about coverage for any home birth practice would be to contact the practice and specifically the billing person from the practice, as they're the ones that are able to tell you best which insurances cover, which don't, what kind of reimbursement or coverage you could expect from various insurances. Because again, when you're out of network, it makes things a little bit more challenging and requires a little bit more legwork. But there are a number of really phenomenal billers. I'm blessed to be able to work with a fantastic biller, and I always tell patients, don't ask me about the billing part, and don't ask my biller about your vagina, because she's not going to be able to tell you. And I'm not an expert in billing, but she is fantastic about it. So again, every practice has somebody that they work with, and most clients can get the majority of their home birth covered, just like most clients can get the majority of their hospital birth covered. There's usually some out-of-pocket fees associated because of deductibles and co-insurances and things like that. But for the most part, most insurances, if handled properly, will reimburse the majority of home birth care.
Thanks, Colleen. Jamie, there's a question for you about VBACs.
Yes, I'm just typing back to it right now. I absolutely attend VBAC at North Shore. It's my very favorite. Do it all the time.
Great, thank you.
Amanda, can I address one of the, there's somebody that just wrote something about an LMHC?
Reading it, go for it.
Is that okay? So one of the people in the audience said that she's a mental health counselor, and she specializes in treating perinatal mood and anxiety disorders, and asked if it would be valuable to have someone like that in-house in an OB or midwifery practice. And the answer is, oh my God, yes. But that's what we've tried to do at Stony Brook. So we do have two people like me who do prescribe medications, and we have two psychologists there, but it's not nearly enough. But it's very, very hard to get programs started because of insurance issues and payment and a lot of red tape. But yes, I think that every practice should have a go-to mental health counselor or social worker or psychologist, and somebody who can write prescriptions. But if you'd like to give me a call, because if you're specializing in perinatal mood and anxiety disorders, call the number that I put in the chat and let's talk.
Perfect, thank you. All right, I think we've hit all the questions in the chat. Does anybody have anything else? Oh, I see another one. Okay, they're popping in. Someone help me with these. Sammy and Janelle, there's a question for you guys.
I'm going to jump in about the transfer one while maybe Sammy pops on. So every practice is different. So I can't speak for everyone, but most practices, and this kind of applies for midwife and OBs, are willing to accept transfers up to a certain point in pregnancy. And again, that might be different. Some practices don't accept transfers after 24 weeks, 28 weeks, 36 weeks. I know the Stony Brook midwives accept even full-term patients as transfers. Usually the biggest challenge with transferring is actually obtaining your full prenatal record from your previous provider. But yes, again, I don't want to speak for everyone, but you know, most of us do take transfers, and it may be in a case-by-case situation.
Okay, and this is Janelle. I'll answer the question regarding the high risk. We do attend the births for the high risk. As far as the management, we co-manage with the doctors. As long as we're there on the labor floor, as long as there's nothing complicated that the doctors need to be in the room for, we deliver them solely by ourselves. If it's something that we feel like, okay, we need the doctors in the room for it, then we'll let the docs know and they'll come in. But for the most part, when it comes to the deliveries, we're usually in there with the patient. We don't necessarily have to have the doctors there with us.
Perfect, thank you. Mimi, it's so good to have you here too. I am a downstate graduate, so is Michelle. There's a bunch of us here. So good luck, congrats. Let us know if you need any help. Such a great program.
Thank you so much. Thank you. It was great meeting you all.
And then there's another question.
Some of these risk questions.
Yeah, someone in the birthing community, why don't you answer the risk question?
All right, so I see Veronica wrote that she had a hospital birth 13 years ago, had preeclampsia, quick healthy birth, 3 weeks early. Would you be considered higher risk next time? So risk is definitely with preeclampsia, you have an increased risk of preeclampsia with subsequent pregnancies, especially if you have the same partner for the pregnancy. You would do also a comprehensive health history. You may be offered baby aspirin, right, as one of the things that reduces the risk. There's a couple different factors, but it's not an automatic that you would have preeclampsia again, but it's something that there would be a lower threshold throughout your pregnancy and might we might encourage different monitoring at different gestational ages, et cetera, et cetera. And then as related to the 35 alone, being of advanced maternal age doesn't make you a high risk pregnancy. It can make you higher. There can be other associated risks with the genetics, et cetera, other increased associations, but that would be a comprehensive conversation with your provider. Okay, I hope that answers the questions. Oh, and then what would be considered high risk where you couldn't have a home birth? Oh, okay. So there are a multitude of different factors. Every home birth practice has different thresholds, but for the most part, low risk is basically a client that is not on any medications to maintain blood pressures, not on any medications for diabetes, for example. So gestational diabetes requiring the use of medication. I happen to be sitting next to Rakaya because I'm supporting a friend in the hospital setting, so I'm looking to my left for reinforcements here. And then with the multiple cesareans, it depends on the provider, right? For VBA2C, some home birth providers will do a VBAC, and others prefer to do that in the hospital setting for a primary. So that's a question to ask your potential home birth provider.
Perfect. Sammy's asking a question here about home birth midwives doing VBAC, and if so, only VBAC ×1, or we do VBA2C. You guys want to?
As a community birth midwife, I will consider a vaginal birth after cesarean. I recently had a vaginal birth after cesarean, a nice 9-pound, 14-ounce baby, and it was a beautiful experience. VBA2Cs I do not feel comfortable with at this time. Still digging into that data, and but each client is a discussion. It's not an automatic for me that I say yes to a vaginal birth after a cesarean. It's really based on the history and a good interview with the client, the potential client. So that's for East End Midwifery.
One Love is the same. I have privileges at the hospital. I do with the patients. I refer people and individualized care. So one thing that I wanted to really push out there is when people are seeking a provider, just remember to interview, right? Like you guys will pair a nice wine with a nice fish. You know, that wasn't a good analogy, but you know what I mean? Like you want to go and find your provider and make sure you jive with them, right? Because you don't want to be cookie cutter. You want to be with someone who's going to advocate for your needs. And other thing that I wanted to say is the midwives on Long Island are close knit. We promote midwifery. We eat midwifery, we sleep midwifery. If patients are seeing midwives and outcomes are good, we're all good. And that's something that's important to say, that we believe in doulas, we believe in midwives that are in practices with physicians that are doing home birth who, you know, as long as you're being cared for by a midwife, listen, it's a win-win-win for all.
I totally agree. And I've been thinking about that this whole time, Heather. And what does Chris Kostas always say? There's a midwife for everyone, right? Or, and I was thinking, like, in what other profession would they all get together and promote each other? Right? It's just, we're really such a group who believes in what we do, and we want everyone to have a midwife. So there are enough patients out there for all of us, and there are enough of us for you. And the more midwives we can have, the better. So it's a great loving community.
I can answer Jesse's question in terms of distance. I can tell you for my first birth, I live in Plainview, and I birthed at Stony Brook Hospital, which I think is about 30 miles, and depending on traffic, could be 45 to an hour. For my second birth, I live in Plainview. And my provider, who was a home birth provider, Michelle, lives in Sag Harbor. So that was quite a distance, and she made it to my delivery with I don't know, 8 hours to spare. So I am a firm believer that, the distance, although it did weigh a really big factor in my heart and in my head both times, it worked out.
This is Laura. I just wanted to jump in quickly to piggyback on what Sammy said in regard to like distance. And this is something I talk a lot about with like clients and people who come into nesting place, like people who live in Nassau County and are worried about switching to someone who delivers at Stony Brook or whatever that may be. And like, it's fully worth the drive. Like, in my opinion, it's one of those things where it's like, it's for good care, for better care, for quality care, and for someone that you connect with. It's fully worth the drive. And that's, I think, goes in both ways. So if you're finding a home birth midwife that is willing to come to you and they're a little bit further than maybe the midwife down the road, it's worth the drive for them too, right? And to me, it's one of those things where it's not worth kind of giving up something that you feel really strongly about just because you're worried about having a quick birth, right? And I think that there are certain hospitals that are more supportive than others on this island, and those are few and far between. And to find one that you really feel like is going to support you, it's worth the drive, even for a 45-minute uncomfortable car ride in labor.
And just FYI, to tap on to what Laura just said, the hospitals on Long Island that have midwives in their facility providing care have lower primary C-section rates overall, because they're doing vaginal birth after cesarean sections. And those hospitals have better birth outcomes for both moms and babies. So when you're looking at the map, think of hospitals that we've all mentioned here have midwifery there. So, if there's a midwife at that hospital, that midwife has ingrained a certain midwifery essence into the care that's being given to all the patients.
All right, you guys have all brought up such good questions and we've covered so many good topics. I'd love to, we're gonna definitely send you guys an email with all the contacts of all the midwives on Long Island. And if anyone has any further questions about, anything midwifery related and you want to direct them to me, I can make sure they get to who they need to go to. I'll type my email in here. If they're not for me, I'll get them to who they need to go to. If I can answer them, I will. Okay.
And Amanda, can I just address something real quick?
Yes.
Just in terms of Veronica's question, what does interviewing somebody look like in terms of preconception? I would say, have in mind some things that are important to you for your care, for your delivery, if it is for going to be for antepartum care and birth, and ask those questions in the interview, whether it's with a midwife, whether it's with a physician. If birthing on your side is something that's important to you, ask, say, is it okay with, will I be able to birth on my side in your facility, in your practice? Will I be able to have clear liquids in your facility? Will I be able to eat if I deliver with you as my provider? Think of how you envision your pregnancy and your birth and ask that provider if that can happen with them.
I think that's a great point, Sammy. And I would also make sure to, just like you would, interview really anyone you're going to be spending a lot of time with and really like allowing to take care of you. You want to also get some feedback from the community. Have any friends or colleagues or family members use this provider, because they may say, oh yeah, you can birth on your side. And then, that time comes and that conversation was never really had. So you really want to make sure that this person's really listening to you. And that's like, so midwife means with women, right? But one of the things that we learn to do is really listen to women. And the number one thing that affects a woman's feelings about her birth is whether or not she was heard and whether she was a shared part of the decision-making during her process. Not how much pain she was in, not the outcome, but was she listened to and did she feel a part of her care? So really, vet your providers for their ability to allow you to be, part of the decision-making process. It should be a shared decision-making process the whole way through.
When was I born?
Okay. Rachel just joined on. Rachel, would you like to say a quick little something before we hop off?
Okay.
So we introduce our practice, who we are, what we do,
I was in the process of responding to you and saying, no, I'm not going to do this. Everybody's been on long enough. I don't want to keep people on longer. I'm really sorry. I don't know how to do the video part. I guess you don't see me, right?
We see you.
Oh, you do? Okay. Oh, yuck. I'm not even. Now I'm really worried. Okay. Well, anyway, hi, everybody. I'm Rachel Lieberman. I'm the owner of South Shore Midwives in Malvern, which is in southwestern Nassau County, sort of on the Queens, Long Island border. So with all the talk about Suffolk County, and it's true that there's loads of midwives all the way out east, we are sort of down under on the other end. The practice has been around for about 16, 17 years. I've been there. This is now my 13th year. It was originally started by Susan Brockman, who was a protege of Dale Cook. And I joined Susan. We were classmates many, many, many years ago in downstate, and I joined her after working in hospital setting. We did hospital birth and Susan did home, but at this point it's hospital only. And I have a real distinction because as I do only hospital birth, my goal is to try to infuse into the hospital experience the midwifery model of care, which I pride myself on, so that it's really very, it's special. And now as far as where I do my births, it's Coney Island Hospital, because I'm also the director of midwifery there. So I bring my patients there. I even have patients coming from Port Washington, believe it or not. They come from pretty far out because they followed me there. And so that's my story. Practices in Malvern. The deliveries are at Coney. Patients love it. They've had great things to say. The care is sensitive. It's very diverse. And they can do pretty much what they want with me. And so they get a real midwifery care birth. And that's it.
Awesome. Thank you so much. I'm glad you're able to hop on.
Thanks. Sorry I was late.
Oh, it's fine. We understand. All right, guys, it's been such a great night. Thank you so much to all of you. Again, we will send the recording. We'll send a list of the contacts. And if you have any questions that you want to direct to any of the midwives, feel free to send them to me and I'll get them to where they need to go. Okay.
Okie doke.
All right. Have an awesome night. And again, we thank you for spending your evening with us.
Thanks, everyone. Thanks, Amanda.
Welcome.
Mom, look how cute he is. What? Don't you feel